My name is Bikram Raychaudhuri. I'm a GP. I work in West Sussex. I'm also the clinical lead for dementia as well as adult mental health in the West Sussex Clinical Commissioning Group. And I'm delighted to interact with you about our message on dementia for all the residents of West Sussex this year. In these changed circumstances, when we are interacting with family or friends who perhaps we haven't seen for some time because of the restrictions due to COVID, um, getting together, especially around Christmas, can be a bit of a challenge sometimes. And that challenge could be perhaps magnified if one of the people you're getting along with has special requirements because of things like dementia. The more preparation you do before getting together, the better it is. And by preparation, I mean preparation A, for the person with dementia, and also for the people that they will be interacting in, so for the rest of the family. You need to remember that some of those family members may not be aware of the current status of the person with dementia, on how comfortable they are with things. It might be a good idea to just touch base with everybody who's going to be attending any of these events, just so that people know what they can do, cannot do, should not do, and what will make things comfortable. The flip side to remember is that for the person with dementia themselves, although the dementia is a condition, the person himself has still got their own needs. And the most important need that often people with dementia talk about is their need to be included. They don't want to be there in a group or in a meeting just for the sake of being there. So sometimes giving them little roles, things that are fairly safe, things that even if there's something that goes wrong will not be a problem, can make them feel included, make them feel productive, and make them feel part of the whole group. So it's little things like that. So if you feel comfortable, if they are able, perhaps helping to set the table for something, or a little task, so they are in charge of some a little activity that they might normally have done in the past. So it's things like that, so that they feel they belong. And another very important thing to remember is that if the person with dementia or the person in a care home is going to be coming out of the home for the first time in a long time, there will probably be some anxiety around that. So you may want to make sure that the time out of their normal setting is perhaps the least invasive way that it's done, the better it is. So if you could minimize a time out, that might be a good option. You may want to make sure that the person goes back to the normal home or setting within daylight hours, so that they're in their familiar circumstances before night falls. And it's little things like that. If you're interacting in a group, if you could try to keep the noise around the meeting slightly on the lower side, to avoid loud crackers and things, you may find that that's useful, because people with dementia often find it difficult to process too much information happening at the same time. So reducing the some of the activity may be beneficial for these groups. So while we are doing everything in our power to make sure that our loved ones are looked after, they're getting the best care possible, and they feel supported in this disease, it is also important to make sure that we recognize our own needs. We make sure that we have perhaps once a week, perhaps an hour a day, perhaps once a month, whatever we can do to recognize our own needs as a person, to interact with our friends, not let our friendships go, to make sure if we need to get support from agencies, so things like Crossroads, which can come out for respite care and things like that, to make sure that our support structures are in place and we utilize them. Now, clearly with COVID, there are restrictions to what is available and what is not available. but nevertheless, there will be something that we can do which we need to do for our own sanity, even if it's just to walk by the beach. Whatever we can do, please make sure that you take care of yourself in these challenging times.